America's top infectious disease expert says the official death count for COVID-19 is almost certainly too low. Yet there are also concerns about overcounting cases, including the concerns of a coroner in Colorado. The coroner says he has documentation to back up his claim, which means our investigative reporter Chris Vanderveen has it too.
Nowhere on the man's death certificate will you find the words COVID or virus. Instead, the coroner concluded the death was the result of ethanol toxicity.
For the layperson, what is that?
That's alcohol overdose, basically.
Montezuma County Coroner George Devers found a blood alcohol content of 550.4 milligrams per deciliter.
Yes, it's very, very high.
Anything over 300, he says, can be fatal. Even though the man technically had COVID, he says he is 99.9% sure alcohol killed the 35-year-old, which is why he remains stunned at the fact that even now the state health department has the death listed here.
They listed it as a COVID death.
Yes, the third COVID death in a county that sits at the very corner of Southwestern Colorado, which brings up another point. The very day the man's body turned up in a park in the middle of Cortez, Montezuma County commissioners sent this request to the state asking to open up businesses in a limited way, citing only 16 positive cases in the county. Monday, the state health department denied the request, saying it still has some concerns about vulnerabilities. Today, the county commissioners let out their frustrations in a meeting posted to YouTube.
I mean, the state can't get away with that. They can't get away with calling something a COVID death when it isn't a COVID death.
As for Devers, he'd like a better explanation from the state.
I called again this morning, left another message, and I've yet to hear from him.
He just wants someone, anyone, to hear him out.
It'd probably be a good place for them to start, just at least call you back.
I would think so. I would think so.
Within the hour, the state health department got back to us saying that the variance wasn't officially denied. It was returned with feedback for revision. CDPHE also said that it classifies a death as COVID-19 when there is a positive test and then someone dies. That raises a ton of obvious questions, like what if somebody tests positive for COVID and then falls off a balcony or gets hit by a bus, you know? We will continue to ask these questions.